my name is Jericho, a practical nurse learner of Bobali. This is the front of my ID. And this is the back of my ID. And my wife is filming me doing this skill assessment test right now. So this is the 360 view of my environment. On my hand is a scenario. So my patient is Alison Chinook. Is a patient who has been admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 1500 hours, and Alison is due to receive an antiemetic 6 hours after her first scheduled chemotherapy. So I have to confirm. I have to know what kind of medications due at 1500 hours for patient Alison Chinook for anti-emesis. I will confirm it on my MAR. It's not yet been signed. So on my MAR, patient's name Chinook Alison at 1500 hours. Dexamethasone 4 mg IVPB piggyback every 6 hours after chemotherapy is the pertinent medication. So now I'm going to discard this. I'm going to record this. And I'm going to compare my doctor's order and my MAR. This is my doctor's order. So patient's name is Chinook Alison, ID number, hospital number 6149730042, hospital ID number 614714973042, date of birth 1960 December 11, date of birth 1960 December 11. The admitting diagnosis is urothelial carcinoma. Visit reason is chemotherapy. Symptom management, patient has no known allergy. And the medication pertinent is an IV is a dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy. On my MAR, dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy due at 1500 hours, not yet been signed, so it is safe to give. And the patient has also an IV therapy which is 0.9% sodium chloride continuous 10 ml per hour in the MAR. So normal saline IV continuous at 10 ml per hour. Now I'm done with the doctor's order. I'm going to compare my MAR to the monograph for dexamethasone. So I want to know if what route is for this dexamethasone and what IV infusion for this medication, since it is given IV piggyback. So patient's name Chinook Alison. Dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy due at 1500 hours. On my on my monograph, dexamethasone intravenous intermittent infusion, yes, indicated for prevention of chemotherapy induced nausea and vomiting. And the dosage for anti-emesis is 8 to 20 mg before chemo, then 4 mg every 6 hours. And IV infusion is 50 to 100 ml mini bag infused over 20 to 30 minutes. And dilution for IV infusion is dilute in D5 water, normal saline, dextrosaline combination, or lactated ringer solution. It's done. It is already compared. Now I'm going to compare my MAR to my compatibility chart to make sure that the normal saline and dexamethasone is compatible. So patient's name Chinook Alison. Dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy due at 1500 hours. On my compatibility chart, dexamethasone 0.9% sodium chloride are both compatible. So sodium chloride is my mini bag and my and the main line of the patient. So I'm done with checking the documents. Now I'm going to inside the patient's room. I'm going to hand wash for 30 seconds, 27, 28, 29, 30 until dry. And the things needed, the supplies needed are my sharps container, my hand sanitizer, my alcohol wipes, my 3cc syringe, my blunt fill needle without filter. It is open. For the purpose of exam, I will use this. My tape for my IV tubing, and my medication label, my IV tubing label for my secondary set. Now, and my secondary set, which is also open for the purpose exam, I will use it. My mini bag, it is also not in the package and open and use. For the purpose of the exam, I will use it, and the expiration September 2019. For the purpose of the exam, I will use this. And my medication, it is also open for the purpose of the exam, I will use it. Expired at 2030 October. And my MAR and my MAR. Now I'm going to do 3 checks on my mini bag. So on my MAR and my monograph, patient's name Shinok Allison. The date today is 10/21/2020 at 1500 hours. Dexamethasone 4 mg IVPB every 6 hours after chemotherapy due at 1500 hours. And so I need to know nothing. And on the monograph, dexamethasone IV infusion 50 to 100 ml mini bag infused over 20 to 30 minutes. Dilution for IV infusion is dilute in normal saline. So on my hand is 0.9% sodium chloride 50 ml. The bag is intact, clear, no cloudiness, no precipitation noted. And the reason for this is for incorporation of the for the patient's medication, which is dexamethasone for IV piggyback. Next, my second check. Patient's name Shinok Allison. Dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy, 1500 hours due. And on my monograph, dexamethasone IV infusion 50 to 100 ml mini bag infused over 20 to 30 minutes, dilute in normal saline. And on my hand is 0.9% sodium chloride 50 ml. The bag is clear, intact, no precipitation and no sedimentation, no cloudiness. The reason for this is for the incorporation of dexamethasone for IV piggyback. The date today is 10/21/2020 at 1500 hours. Now I'm doing my third check. Shinok Allison, patient's name. The medications dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy due at 1500 hours. On my monograph, dexamethasone IV infusion 50 to 100 ml mini bag infused over 20 to 30 minutes, dilute in normal saline. And on my hand, it is 0.9% sodium chloride 50 ml. The bag is clear, intact, no cloudiness, no precipitation, no sedimentation. I'm done with my third check on my mini bag. Now I'm going to check, to do 3 checks on my medication. So patient's name Shinok Allison. Dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy. The date today is 10/21/2020 at 1500 hours due at 1500. Now I have my medication dexamethasone. Total volume is 10 ml. Concentration is 4 mg per ml for IM and IV. Expiration is 2030 October. The reason to give this, the indication is for anti-emesis after chemotherapy. And the date today is 10/21/2020 1500 hours. It is a ward stock dose, so there's no name of the patient. Now I'm going to compute for the dosage that we're using. The desired dose is 4 mg over stock dose 4 mg times 1 ml. Cancel. Could be 1 ml. So I'll be needing 1 ml of medication. Now I'm going to open the medication vial. I'm going to sanitize it with alcohol swab for 30 seconds using the circular motion and until dry. 27, 28, 29, 30 until dry. I'm going to open my 3 cc syringe. I'm going to open, making sure that I don't touch the inside of the plunger. I'm going to open the blunt fill needle without filter, making sure that I don't touch the shaft to prevent contamination. So I need 1 ml of air. It's at 1 ml of air. I'm going to inject it inside the medication vial. Slowly, not to produce air bubbles. Now I'm going to withdraw 1 ml of air of medication from the vial. Slowly, not to produce air bubbles in the syringe. I'm going to check for air inside the syringe. Going to remove the air, withdraw the air. Going to recap the syringe above alleyway. Then I'm going to show you that there's no air in the syringe. I'm going to rotate it. I'm going to show the medication vial. Now I'm going to date and time the medication vial. Open. 10/21/2020 at 1500 hours. J low PNL. Now I'm going to do the my second check of my medication. So my patient's name Chinook Allison, dexamethasone 4 mg, IV piggyback every 6 hours after chemotherapy, 1500 hours due. And on my hand is dexamethasone 10 ml total volume, concentration is 4 mg per ml. For IM and IV, 1 ml for IM and IV, and the date today is 10/21/2020, and the time is 1500 hours. This is for the anti-emesis after chemotherapy. So I'm done with my second check of my IV. Now I'm going to sanitize the port with my mini bag, because I'm going to inject the medication into the mini bag for 30 seconds using the circular motion. 10/7, 10/8, 9:30 until dry. Going to remove the cap of my needle, going to straight to the needle sharps container. Going to inject now. Slowly, not to create air bubbles inside the mini bag. The syringe inside the sharps container. I'm going to roll the mini bag for proper mixing and for not to prevent and not to produce air bubbles. Then I'm going to label my medication mini bag. So patient's name Chinook Allison. Medication's name is dexamethasone 4 mg IV piggyback every 6 hours. Four milligram per 50 ml. Normal saline IV piggyback. The date today is 10/21/2020. The time is 1500 hours. To sign my name, J Low initial, and my designation PNL. Now I'm going to put the label my patient's IVP mini bag. This is the front of my mini bag, and this is the back of my mini bag. Now I'm done in the med room and going inside the patient's room. The things needed for is the MAR, piece of paper, my compatibility chart, my mini bag, my secondary set, my hand sanitizer, IV tubing label, some alcohol swipe, ball pen, and some tape. Knock knock. Hi. My name is Jericho. I'm a practical nurse learner. I'm your practical nurse learner for today. I'm here to hang some medication your doctors ordered. I will hang it here, there near your IV, and will insert it in your main line. So I need to hand wash first for 30 seconds and 7 to 8 to 9:30 until dry. Is it okay with you? Patient says yes. So before we start, I need to confirm your identification. Can you tell me your name? My name is Shinok Allison on my MAR. Shinok Allison. Can you tell me your date of birth? She says 1960 December 11. My MAR December 6/11 1960. And hospital and in hospital ID name Shinok Allison. Date of birth 1960 December 11. And his ID number is 614973042. Hospital ID number 614973042. So I got the right patient. Now I'm going to do the 3 safety check. I'm going to engage the bed break 1, 2, 3, and 4. Now I'm going to pull up one bedside rail up. Then I'm going to adjust the bed rail to a working height. I'm going to halfly close the privacy curtain for patient privacy. So, do you have any allergies to food or any medication? The patient says no. So patient has no non-allergy. Do you want to go to the washroom before we start? The patient says no. Okay, so I would like to check the IV site now. Line, the primary line, and the IV and the main IVF. Now, on IV side patient is used. It's on the right hand. There was a IV insertion of gauge 22. It's properly secured and properly taped with Tegaderm. It is dated on 10/21/2020 at 0800 hours. Signed with designation. I will touch this. Can tell me it is painful. So the patient says no. So there's no redness, edema, there's no tenderness, not swollen, and there's no leakage of the fluid. I will check the entire length of the IV fluid, IV line, the primary line. There's air. So it looks like there's no air on the primary line. There's no discoloration, no precipitation, no sedimentation. On the drip chamber. On the drip chamber, it is patent. It is a good flow. The air is the water is on the line on the drip chamber. No discoloration, no precipitation, no sedimentation. It is properly labeled. On 10/21/2020, time is 0800 hours. Sign and with designation and primary line and normal saline. Now I'm going to the main IV. So his main IV is sodium chloride 0.9%. So on my compatibility chart, dexamethasone and 0.9% sodium chloride is compatible. So we don't need to change the IV for the dexamethasone, the primary line. And it looks like intact. There's no sedimentation, no precipitation. And it is properly labeled 10/21/2020 0800 hours and primary line and normal saline. Now I'm going to do my 3 checks on the bedside. So on the my MAR, patient's name Chinook Allison, dexamethasone 4 mg IV piggyback every 6 hours after chemotherapy, due at 1500 hours. In my hand is a dexamethasone 4 mg 50 ml normal saline IV piggyback. Date today is 10/21/2020 at 1500 hours. Patient's name Chinook Allison, and this is given for anti-emesis after chemotherapy. So I'm done with my 3 check. Now I'm going to compute for the drip rate for my mini bag. So mini bag is 50 ml times the drip rate 10 ml per 10 drops per ml, and I will be using the 30 minutes. So 16.666, rounding off to 17 drops per minute. So I'll be using 17 drops per minute, and the main line is 10 drops per hour. Now I'm going to hang this. I'm going to sanitize the port of the primary line, because I'm going to prime my secondary line with alcohol swab for 30 seconds using the circular motion, 7 and 8 and 9:30 until dry. Then I'm going to inspect and prime this secondary line, making sure that I don't touch the uncapped tip of the secondary line, and that make sure that I don't put the tip, the two ends below my waistline level to prevent some contamination. So they're still capped. The lines looks like intact, no discoloration, no sedimentation, no precipitation, and no cloudiness noted. No cloudiness noted. Now I'm going to insert the secondary line for priming to the port, lower lock, in connecting the lower lock of the secondary line to the primary line. I'm going to close the primary line. I'm going to check for air. So there's no air already on my primary line. There's no air already on my primary line, on my secondary line. Now I'm going to sanitize the port for no. Now I'm going to insert this secondary line to my piggyback. Remove the cap. Already inserted. Now using the secondary hanger, I will hang my secondary line, my primary line lower than the secondary line, so it will be a good flow for the primary line. Good flow for the secondary line. Now I'm going to open the secondary line and open the primary line. Here. Already check the air. So there's no air anymore. My secondary line, it's a good flow, running at 17 drops per minute, and no flow for the primary line. Now I'm going to sign my MAR. J low PNL. Sign MAR. I'm going to label my secondary line 10, 21, 20, 20 at 1500 hours. J low PNL secondary line normal saline. I'm going to attach it. This is the label. So still having a good flow. So my patient stitching is this is the cable to press this to notify if there's no IV. Press this if there's to notify if there's no is the bag, the IV bag is empty, and there's no water in the drip chamber, and if you see that it's painful in your IV site, if there's water leakage, and also if you feel there's headache, dizziness, and your environment is spinning around. And now I'm going to now I'm going to maintain the bed brake, the 4-bed brake, and also the bed rail up, one up. Then going down, I'm going to lower down the bed height. Going to open the privacy curtain. I'm going to tidy my things. Done. Then I'm going to hand wash. I'm going outside the patient's room. Then I'm done.